Hi friends, I am Dr. Pratap Singh Rathod. I have done MD in pharmacy medicine, and today we'll start with new topic that is impotence and sterility. By definition, impotence means it is an inability of a person to perform sexual intercourse and achieve gratification. So it may be male or female where they are unable to perform in during sexual intercourse. It is called as impotence. Whereas by definition, sterility is absolute inability of either a male or a female to procreate. Here, in male, it is unable to make a female conceive, and in females it is inability to conceive children. So it is absolute inability means they cannot have children. Maybe male, it may be conditioned to male or female. In male, it means mainly because his sperm count or it may be because of any condition, he is unable to conceive, female conceive. And in female, they, because of lack of ovarian tubes or disease of fallopian tubes, he is unable to conceive children. That is sterility. Coming to causes of impotency in males, first of all, it is one of the first is psychological condition where there is no any physical damage or physical cause, but psychologically that it, the person has impotency. One of the causes is absence of desire for sexual intercourse. The person may have psychologically may doesn't have desire for sexual intercourse, maybe because of dislike of a partner. So he may dislike this partner. It may be fear of failure, anxiety, mood disorders, guilt, there's some aversion or low self-esteem or some sexual abuse may be conducted or childhood sexual abuse may be there or some masturbatory anxiety may be there. So he may be masturbatory, maybe continues doing masturbatory and he may not be able to have say become impotency during performing sexual. One of our sexual condition is widower syndrome. In this condition, once the wife of the husband dies, he is unable to perform sexual intercourse with any other. Then one more condition that is called as a quad. In this condition, the male may be impotent with one particular female, but not with another. So if that woman comes, he is unable to perform sexual intercourse, that woman only, and not be impotent with. There may be some post-traumatic stress disorder related to some surgical trauma. There may be overindulgence may be there. There may be a condition like excessive masturbation may be there, also may lead to impotence. Next cause is the age. So age is not a particular cause may cause impotency, but before puberty, most of the times boys are impotent and sterile as well as where they cannot conceive any children. Poor physical development of penis is also common cause of impotency. In advanced ages, there may be decrease in libido. The person may not be able to have sexual desire or libido may decrease. He may not be sterile, completely sterile. Hence, the male can conceive children at any age. Congenital and acquired malformations, such as bilateral hydrocele, where there is accumulation of fluid in the testis, which can cause person is unable to erection. Then there may be bilateral inguinal hernia, where the intestinal contents may come outside the abdomen. There may be decrease in size of penis or absence of penis because of some congenital disorders. Severe form of hypospadiasis or epispadiasis, where urethral opening is maybe below just below the glands, or it may be present above the glands. There may be Klinefelter syndrome, which is one form of intersexuality disorder in conditions where because of genetic disorders like decrease in one X chromosome or extra X chromosome, which is in Klinefelter syndrome XXY or Turner syndrome XO, there will be congenitally able to have that is impotence may occur. Then there is cryptorchidism where the testis may be not be descended into the testicular sac. Some local are gender diseases. So some local diseases related to genitalias and some gender diseases related to body. These causes again we are discussing this slides. In chronic poisoning conditions, mainly the poisoning conditions like lead, arsenic. The person is in working in some factories and continues to exposures to this type of metallic poisons can cause impotency. Also sometimes sterility. Medications. If the person is under medication like antidepressants, usually SSRIs, antipsychotics, antihypertensive drugs, anti-ulcer agents like steroids, these all types of drugs can cause sterility. Some behavioral factors like lifestyle choices like chronic alcoholism, Smoking, which is seen to be cause impotency. Overweight, avoiding exercise can also lead to addictions. Certain drugs such as morphine, heroin, opium, cannabis, cocaine, tobacco, all if the person has substance abuse of these that's addictions can lead to impotency, can also lead to sterility. Coming to causes of sterility in males, similar to causes of impotency, certain causes can also lead to sterility, like congenital abnormalities, like loss or absence of both the testicles, cryptorchidism, where testis is not descended and it is present in inguinal gland. There is testicular atrophy maker. Clear form of urethral fistula, where the urethra is unable to urethral fistula because of urethral fistula, the is not ejaculated. Then age, that is before puberty, the males are sterile and cannot have children. As but future in after puberty, they are usually can have children at old age. Diseases, certain diseases like local gender diseases can also cause impotence as well as sterility. Chronic poisoning, as I discussed, lead, arsenic particles can cause sterility, as well as some addictions of drugs can also cause sterility, as well as coming to local and general diseases, which can cause both impotency as well as sterility. Certain these conditions can cause sometimes impotency as well as sterility. One is priapism. Priapism is painful erections because of skin adhesions. There may be painful erection. There may be hydrocele, where there is accumulation of fluid in the testicular tracts. Elephantiasis is the infection of lymph glands. There is swelling of the entire lower limb occur. And phimosis, there is obstruction, that is obstruction in the foreskin of the penis, also cause pregnancy. Adherent pupils, orchitis following mumps, syphilis, and tuberculosis can also cause sterility. Mumps may cause sterility and may not cause impotency, but it causes sterility. Exposure to X-rays earlier childhoods during puberty can also cause sterility, where progenitors' sperm cells will die. Coming to gender diseases can cause which causes impotency and sterility. Acute illnesses, any form of acute illnesses can cause impotency, like high grade fever. In high grade fever, also the person may experience that he is unable to perform. Neurological conditions like Tabes dorsalis, multiple sclerosis, paraplegia, hemiplegia, synomelia, where mainly if any nerve damage or nerve trauma occurs, the person's sensation is lost in the dance and the person is unable to have endocrine diseases like diabetes, thyroid dysfunctions, atrophy following renal failure, hemochromatosis or cirrhosis, blood vessels can cause impotence as well as sterility, where there is decrease in sperm count because of that may cannot have. Any form of nerve trauma can cause impotency, person not able to perform or were unable to perform because of decrease in sensation. Certain severe disorders like Leach syndrome and diseases like tuberculosis and nephritis may cause impotence. Malnutrition, zinc deficiency may also cause erectile dysfunction. Those were the causes of impotence and sterility in males. Coming to cause of impotence and sterility in females. First and foremost, age. So before, as I mentioned, puberty is the age of first sterility. So before puberty, males and females are sterile. But in females, particularly, there is a condition of menopause where the menses stops after age of menopause, usually at 45 to 50 years. That time, after that menopause also, females become sterile. Impotency as per se, female is not applicable, it doesn't come under female, as female is a passive agent. So impotence is very is not seen, but there are certain conditions which is also related to may stimulate like the female cannot be perform sexual activity. That condition, one of the condition includes corrosive vulva, which is seen in old women, in which there is narrowing of vagina. Since there is narrowing vagina, may not be able to participate in sexual. Infertility may also rise significantly as age increases, as 30, 35, 40. As age increases about 30 years, the fertility of the female also. Certain developmental acquired abnormalities. Impotence may results from total occlusion of vagina. So if the vagina is not completely patent or it is completely occluded, which leads to impotence. Lesions of labia may occur, lead to improvement hymen. Injury or operation of IMI can lead to stricture formations. Because of stricture formation, there is decrease in able to perform sexual. Absence or abnormal uterus, ovaries of fallopian tube can produce sterility. So, because of not an uterus, the child may not get impregnated. The child may not fetus may not develop in the uterus properly. Or if there is a strictures in fallopian tube, then the egg may not be travel and it may not get fertilized, leading to sterility. The local diseases can which causes impotence and sterility, like Bacterial cyst formation, cancer or canker of vulvae, stricture formation of any form of stricture because of injuries or surgical stricture. Collapse of uterus, where uterus may come out of vagina, urinary bladder and dyspareunia can cause impotence. Certain diseases like pelvic inflammatory disease, peritoneal adhesions, endometriosis, ovarian cyst can produce blockage of fallopian tubes, which ultimately leads to sterility. These are conditions like inflammatory disease, lesions, endometriosis can cause. This is our genital tract, like gonorrhea, leukorrhea, acidic vaginal secretions can lead to sterility. Certain gender diseases like infective conditions, metabolic and hormonal conditions may cause sterility. Chronic poisonous exposure to lead, arsenic can cause sterility. Between sterility. Environmental factors such as addictions. The female is exposed to certain excessive heat or X-ray radiations or microwave radiation can cause sterility. If she is drug dependent to alcohol or opium, can cause sterility. She is under medications of chemotherapy can cause sterility. Then, if she is on oral contraceptives and certain stoppage can cause hormonal imbalance, leading to psychological conditions. So, psychological conditions which can cause to commonly causes impotence in females. First and foremost, there may be hysterical fits. In this condition, any attempt to perform sexual intercourse result in severe fits like contractions. This may be because of hatred to male sex or fear or excessive passion. Next, one more condition, psychological condition is vaginismus. Here there is a because it may be called as fear, pain, and disgust, and just apprehension of the effect intercourse can cause vaginismus. It is a severe condition. So vaginismus is a very serious condition. In this, there is a severe spasm of lower one third of vagina involving paravaginal muscles, levator muscles, and adductor femur. So in this female, just approach by a male for sexual intercourse can cause severe contraction of lower one third of vagina. So there's other muscles like paravaginal muscles, levator muscles, and adductor femur muscles. And the pains, the contraction are so severe that she may lose consciousness or the painful contractions may not be get also. It is a form of involuntary reflex which replaces the rhythmic contractions associated with anticipated or actual attempt to near penetration. So there is no control over it for females, and just by approach by a male for sexual intercourse can cause this reflex contraction of muscles. It may occur in equal severity in both the woman who has already experienced children or who already have sexual intercourse and has children as well as in virgins. Because of that, it can be divided into two types. Primary vaginismus, which refers to experience of vaginismus with first-time sexual intercourse attempt. It may be seen in only first-time virgins who are approaching sexual intercourse. Secondary vaginismus refers to the experience of vaginismus a little later in life after a period of pain-free homosexual, typically following temporary pelvic problem. So it may be seen sometimes even in child-born females, and maybe because of some pelvic problems. It's may Common etiological factors in vaginismus includes common is the male sexual dysfunction. So the female has dysfunction just having a disgust for sexual dysfunction used to. They may be psychosexually inhibiting influence due to religious unorthodoxy. So some religious beliefs in the mind of a female can also cause vaginismus. Incidence of private sexual trauma. This is the commonest condition where he may have experienced some psychological trauma beforehand, sexual trauma present. This may be because of dyspareunia or sometimes disgust or dislike to practice. Coming to medical importance of impotency and sterility. First is civil causes. Civil causes mainly because of which occurs between the two person. First is the nullity of marriage. So by definition of marriage, usually the definition of marriage states that is a union between male and female, and which has to be conceived or it has to be done, has to be upheld by natural sexual intercourse. But if the person is impotent, if the male is impotent and he is unable to sexual intercourse, then female has a right to nullify the marriage and she can get divorce. She can get apply for divorce under Indian Marriage Act 1955 and Special Marriage Act 1954, where she can approach for divorce because the male is impotent and cannot have a sexual intercourse. In case of adultery conditions, in these conditions, if the male is caught having a sexual affair with the another person, what is adultery, he may plead that he is impotent and he is that whatever the accusation is case of disputed paternity and legitimacy. So if the person is sterile, so if the male is sterile or if the female is sterile, and mainly if the male is sterile, male sterility in case of male sterility, and a female is already born a child, it indicates that the, the born child may not be uh, their naturally born, and it may the father of the child may not be her. Because he is already sterile, he may not have children. The paternity dispute occurs where the legitimacy of the child is become questioned. Case of suits of adoption also these cases arise where this is adoption is usually applicable to parents who are sterile or cannot have children, and if they are not sterile, then adoption suits cannot be claimed. Claims of damages where loss of sexual function is claimed as a result of assault or accident. In person who are working in some factories or any injury and just the normal injury, and if he experiences some normal injury and he may claim that he's become impotent because of that injury and may claim damages from that. Now coming to criminal causes. First of all is the adultery cases. Adultery, as I mentioned, if there is adultery case has been filed against a male, he may claim that he is impotent. That is may also applicable in case of rape conditions or unnatural sexual offences conditions, where impotence is pleaded as defense against the conditions. He may plead that he is impotent and cannot able to perform sexual intercourse, so he's not has to be not be guilty of adultery, rape, or any unnatural sexual. This can also be used sterility if the person is sterile, and a female may claim blackmail that she may have conceived the child of that person, or the person may be impotent and the female may claim that that person has have raped and may blackmail or defame the person, popular person may be seen. But in all cases, uh, impotent sterility, they some references.